Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spell, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally, and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Today's guest is a doctorally prepared nurse who has over 35 years of nursing experience in lifestyle medicine and community health education. She holds national certifications in lifestyle medicine, health coaching, plant-based nutrition, and exercise physiology. Her unending passion for lifestyle medicine and community health is expressed in varied ways, and the essential work that she does and engages in, which includes maintaining a clinical practice as a family nurse practitioner and wellness coach, and a nursing professor at Southern Adventist University. And she just published a new textbook with colleague Dr. Laureen Downs, which is titled Health Promotion and Disease Prevention for Advanced Practice, Integrating Evidence-Based Lifestyle Concepts, the first edition. So through her decades of caring for people across the lifespan, she knows that information alone is insufficient for lasting behavior change. Rather than just prescribing solutions, Dr. Tryon enjoys transformative conversations that help others to explore new ways of thinking about their health and to personalize strategies for achieving the goals that are important to them. And she also values a very holistic approach, which is integral to nursing practice, incorporating mental, emotional, and spiritual aspects with physical health. And as a Christian, Dr. Tryon believes that the key to experiencing health and healing is to cooperate with God's restorative work in all of us. She encourages people to explore their faith as a means to inspire hope, encourage personal responsibility, and increase motivation and confidence for personal change. So we know you're busy, and we are so thankful and grateful that you're talking to us today. We're so glad we made this happen before our presentation.
Thank you for the privilege and for the patience that you've had with me in my busy schedule.
You are welcome. So what we start with usually is just if you can tell us what your current role is. I touched on it there, and to really hone in on the educational piece, nursing education. So can you tell us about that role specifically, and just all of what you do also, and how you got interested in lifestyle medicine to begin with?
I think that lifestyle medicine interest goes back to my youth. So I can't remember a time I really wasn't interested in healthier living. I can't pinpoint anything on that, although I did grow up in a family that has a lot of lifestyle-related chronic diseases. And my efforts to exercise, and I proclaimed myself a vegetarian when I was 12, much to my mother's dismay. It has enabled me to avoid all the lifestyle-related diseases that I see my family experiencing. It just underscores that importance. I want my family to experience health and vitality too. And that's kind of fueled me for patients because I see in them the same challenges that I've seen my family experience. Going back to your question on education, I'm privileged to teach here at Southern Adventist University in our doctoral program. We have one emphasis that is lifestyle medicine. We were the first institution to have a doctoral emphasis in lifestyle medicine. And that has been exciting to see develop and evolve over the years. My role is to coordinate that program, and I teach not all of the courses, but a number of them. I teach a course in Intro to Lifestyle Medicine. I teach health coaching for health professionals, which integrates a strong motivational interviewing approach to coaching and counseling patients. I teach a nutrition course. I teach an exercise course, a chronic disease course that uses lifestyle medicine approach. And I say I have all the fun classes. I've taken my turn, of course, teaching research and theory and other courses like that, but I really enjoy the lifestyle because I see the impact it can have. And I'm most inspired when students will resonate with the lifestyle medicine theme, of course, but they especially come alive with the health coaching course because we are so used to being an expert in healthcare and providing advice, and sometimes being frustrated when that advice isn't accepted or carried out, when we haven't really made a difference because of our efforts of teaching. And when they see that sometimes we have to take that nursing expert hat off and put a coaching hat on to really respect the patient, where they're coming from, understand their story, give them autonomy in being a partner with them to support them in their health behavior change, that just opens a whole new world of thinking to them and a whole new way of relating to their patients. And so that's always exciting. So that's what I do here. I've worked here for a number of years. I've actually recently moved to a part-time position so that I could balance life a little bit better. Being focused on lifestyle medicine, you have to look at your own lifestyle over and over again. And there's got to be a level of integrity in that I have to practice what I'm teaching and what I'm talking to my patients about. And I have not been able to do that well with 2 jobs, clinical and teaching full-time. And so now I'm 3/4 time teaching, and I'm a day and a half in the clinical setting. And that's provided a little bit more of a balance. So clinically, family practice, but I had the opportunity to work in a lifestyle medicine focused practice, which really enables me to apply everything that I teach my students and gives me that real life, fresh experiences to then share with them in class.
I love that. Deborah and I are passionate people like you. And so we often talk about being able to strike that balance like you're talking about. That's great that it's a lifestyle medicine practice, because that allows you to kind of keep your finger on the pulse of what's happening out there in clinical practice. So that's an important piece as well, I think, to be an educator. A lot of my educators also were clinicians that way. Mm-hmm. And I felt it was helpful to me. So thank you for
the emphasis. The courses I teach are required courses for the emphasis. However, they are also all electives options for any master's or graduate or DNP student in our graduate program. So I get a variety of students, some that are focused on lifestyle, that's their passion, and they are taking a whole DNP emphasis in it. And then students that have a little bit of an interest in it, they're doing family practice or psych mental health, and they want to be able to have a little better background in nutrition or physical activity. So I get a variety of students that way.
Right. How do they respond to it? Especially maybe the ones who aren't in the track necessarily, they're just taking it as an elective. What has been their response to what you're teaching and how you communicate that?
It's been positive. Well, those students are taking it as an elective, so they have opted to take that class. So they generally come in with some interest already, sometimes even some background Very often there are personal stories of like my own and my family of origin and why that's inspired me in the area of lifestyle medicine. They come with their stories too of personal health challenges that have been overcome with lifestyle or family. And that fuels them on to be able to have those tools in their toolbox as providers.
I would like to talk more about all the nursing curriculum, but I'm going to hand it over to Deborah because she always so nicely synthesizes the information.
Thank you, Susie, for your kind introduction. Susie's always so generous, and I just want to just share that I just love working with you, Susie. It's really it's a gift. So we were chatting at the early part, Dr. Tryon, about the direction that we're going in now with nursing and education, which is so exciting to us when we see what's happening. Susie and I wanted to know if we could just kind of open it up to you based on where we had begun our conversation before the formal introduction with the curriculum as it lends itself to addressing the social determinants of health that we're all focused on at this time, and also with the lifestyle medicine piece and understanding how it is all connected.
I think that lifestyle medicine certainly can be integrated in all of those essentials, but where it finds its happy place is in the essential of health promotion. I'm not an educator, born and bred educator. I never really wanted to teach. It was not my aspiration, but it is where the Lord has led me. And I feel like what I bring to the program here is a strong focus on the practical. I taught research and theory, so I'm very familiar with all our nursing theories and, evidence-based for nursing and such. But where my heart is at is the clinical side, and how does this make a difference with our patients and in how I'm going to approach them.
And then may I ask, from that clinical perspective, and as you teach your nurses and advanced practice nurses going out there, how do you embody and teach them about being a nurse in practice? A 30-second share about when I was studying for my NP, I thought, okay, well, this is medicine, and we're learning about all these medications, and I'm going to be practicing medicine and diagnosing at this level of diagnosis and then treating. And I thought, but I'm still a nurse. So I'd love us to just talk about how we as nurses are in this world and in addressing the whole patient, in seeing the big picture and practicing that very holistically that you are so familiar with and that you model for your students and future advanced practice nurses, and that we were even just sharing about from that systems perspective, where do we fit in with that?
I often think back on my fundamentals nursing class with therapeutic communication skills and how sometimes we learn that and then put it on a back burner, and because of all that's required of us as nurses or advanced practice nurses. But the most important thing that we have to offer our patients is a relationship that treats them as a valued person, that is interested in their story, that communicates respect and compassion. And so to me, those aspects of nursing are more important than anything else, because people don't remember everything that you tell them, but they are going to remember how they felt in the conversation with you, whether they were affirmed, whether they left hopeful, whether they left maybe with a new understanding or a new insight. So to me, that is a piece that can't ever be missed or forgotten or put by the wayside. We have to always remember that the most important skill we have is our relationship and our conversation. So, in the busyness and a short time frame that we have with a patient and focusing on getting the orders put in and the documenting in the EHR, to be able to look someone in the eyes and convey that, I think is where I don't want to lose sight of that as a nurse. That's, to me, the most important piece that we can offer.
Thank you so much. That is an underpinning of your practice wherever you go as a nurse. Thank you. Susie, would you like to jump in then too? Thank you.
I would like to ask if you can reflect on when you started to bring this to life within your university, and ask you about key relationships you had to have to move the needle forward on this, challenges you ran into, how you overcame those challenges, because there's only a handful of schools of nursing around the country right now who are offering anything related to lifestyle medicine, which of course we all hope is going to change and it will grow bigger. Some people, it's just a course or two or an elective, and only a couple now that have an actual full curriculum. What did you need to make that happen?
Well, I was not the forerunner. I have come along since they started the DNP program. So I'm walking in the shoes of some other people who I respect and admire for bringing this to the forefront. I think being a Seventh-day Adventist institution and having a strong emphasis on health and healthy lifestyles might have been a positive factor in moving that change forward. When we were starting a DNP program, I think they were looking at trying to project what niche we could provide and what areas of need would surface. And so that's why lifestyle medicine was one of our first emphasis. We have now several DNP emphasis. I know one of the challenges that we faced early on was that it was not allowed by our creditors to be called lifestyle medicine. Our initial degrees that were conferred were degrees in lifestyle therapeutics because we were nurses and we couldn't use that word medicine. So that was one challenge. One of the things that helped change our creditors' mind actually is the American College of Lifestyle Medicine's inclusiveness in their organization of other disciplines. It's not just a medical specialty. There are, so many other healthcare professionals on board. It's a team approach that is needed. And so that really helped make that change.
That's amazing. And we've had some conversation with others around the words. Right. I know in a couple of places, they did not want to use the word medicine and had to change it to nursing, or like you guys did in the beginning with the therapeutic. So I think that may be an area that will evolve over some time, and maybe it depends on the institution. What about ways that either you yourself collaborate with other members of the healthcare team, or that you encourage your students? Is there anything that goes on interdisciplinary wise? In particular, we feel one of the sticking points with lifestyle medicine is the pillar of nutrition, to make sure that we as nurses are staying within our scope, but which is very large actually when it comes to nutrition, but to recognize that, to have the education around it and be able to provide some patient education around nutrition. Also, just how we can collaborate and lift each other up when it comes to lifestyle medicine.
One of the things that we did last year that was really exciting, it was a lot of work, but it was a lot of fun and well received, was had a culinary medicine lab on campus for our graduate students. All of the undergraduate nursing students and other students on campus got pretty excited about it too. So I'm not quite sure where it's going to expand next. But our graduate students have a number of on-campus labs, such as reading EKGs or suturing. So this became an option for them to take as another on-campus lab. And we partnered with a dietitian that teaches in the School of Health and Kinesiology, and we partnered with our culinary arts program here. So we had a 4-session culinary medicine lab. And what I think was helpful about that is that it really showed the strengths of each of those professionals, the chef, the dietitian, and the advanced practice nurse or nursing, and how they could work together, what each brought to the relationship or to the benefit of the patient. We spoke specifically on when to refer to the dietitian, because I think that is important. The dietitian also spoke to the applied nutrition and how some of the things that she would share with a patient. And so it's helpful to be able to see from that side. When we refer to a dietitian, we often don't know what our patients are going to be experiencing. And so to be able to hear her approach was helpful, and her pointers for us as nurse practitioners. And then, of course, the same with the chef. I can cook. I've cooked for years. I love cooking, but it's different hearing from a chef as to why certain things are done certain ways, or the flavor profiles, or anyway, it just took it to a whole different level. And that was really positive. We're not sure what we're going to do next. That just ended a couple of months ago. And I've already been asked what's next. So that's on the table. But the collaboration is what made that work well. If I had tried to do it myself, I've taught cooking classes, I've taken nutrition courses, I've taught a nutrition. I could have done that, but it's not as impactful as having the dietitian on board with us. And same with the chef. So I think that collaboration, we know this in healthcare, the team model is utilized over and over again in helping our patients receive the best care that they can have. And doing that in the academic setting, I think was powerful too, because it brought a richness that I couldn't have brought alone.
I love that. That sounds like so much fun.
It was a blast.
I love, and most of us in lifestyle medicine love to continue to learn. And as nurses, we're called to be lifelong learners and be curious. So I think there's so much that we can gain and learn from them. But also some of the questions that we've asked a couple of dietitians are, where's the line in the sand? When do we refer? So those are really important things to know when you're getting so granular, maybe the dietitian bringing them in, because there's many more nurses than there are dietitians. And so knowing when to engage them and their expertise is important.
And also the fact that insurance doesn't cover physician visit except for certain diagnoses or certain healthcare plans. And so it's helpful to hear from the dietitian, these are the points that are important to get across to your patients if they can't see a dietitian, and keep this in mind and look for this. And it was very valuable.
Yes, it sounds like it. Every time I talk to an educator, I want to go back to school. What other teaching methods do you think are the best to bring lifestyle medicine into the classroom? So that collaborative sounded phenomenal. Are there other things that are experiential that really resonate with your students?
Well, every one of my classes, I incorporate some, for lack of a better word, lab or clinical component. Some of the courses, they are working with individuals. For example, in the course of exercise, they are to apply the exercise to themselves and do some field testing to check their level of fitness and create an exercise prescription and follow themselves, but then also to work with an individual. But I also encourage them in all my classes, what are the resources in your area? So I want you to spend some time outside of class, really getting your finger on the pulse of what's in your community, because one of the ways I'll empower you is for you to be able to know what your resources are, where you can refer to, who you can network with to work with your patients. So a little bit of a lab component like that is focused on either working with the patient individually, applying it to their own lives, or looking at community resources. We use case studies because that helps it come alive. And I like guest speakers, particularly in my course of lifestyle medicine for chronic disease, getting providers that use a lifestyle medicine approach, but that maybe their specialty is pain management or GI or cardiology. And so their perspectives can be really good. And then they hear from a variety of people. They're not just hearing from me as well. So that engages them and also gives them ideas, builds their understanding of how big and broad lifestyle medicine can be.
Right. That sounds amazing. I love the experiential piece, which I didn't get as much of that. We've heard that over and over from educators about applying the concept to yourself first, which I think is great, because then we realize how difficult behavior change really can be. And then we have an all new appreciation for that. As a little side note, I look at a lot of food logs, and I was telling people to use a certain app and bring me their apps and their logs. And I thought, well, if I'm going to tell them to do it, I better do it too. And it's not that easy, It takes a lot of effort.
Point of trying just about everything that I would recommend a patient do, just so I can have a little bit of that experience. I'm really big on the practical and the application. And so my students probably get sick of this, but I'm always looking at, all right, what are we learning? What are the new concepts that we're trying to get across here? So that's the what. So what? Why does this matter? What difference does it make? And then now what? What are you going to do differently in your practice now that you know this? Or in your own personal life, how are you going to apply this? So that what and so what and now what is another way I think that tries to emphasize the practical side of the courses I teach.
Right, that's genius. I love that. You talked about community health, and I know you have a focus on community. And I went to my undergrad. Actually, it's just where I went to school for all of my degrees, but I had a real focus on vulnerable populations and community and public health. So I am curious as to what your experiences have been with your students or with incorporating, there's a big focus now on the social determinants of health and how nurses, there's been a call to action from the National Academy of Medicine for nurses to lead in terms of addressing social determinants of health. So how do you incorporate some of that, or do you work with vulnerable populations? What is your community like?
I missed the last bit of your question because you went on mute, but I think I understand what you're asking. I'll answer that in a couple of ways. One is, for a number of years, I worked at a clinic for uninsured population here in the Chattanooga area. And that allowed me also to bring students in to help me if I was teaching a diabetes class, for example, or a cooking class, or sometimes I would help them use that setting for their capstone projects. And so I'd bring students in to work with that population and really begin to understand some of the challenges that they face. The DNP program, the lifestyle medicine emphasis, is an online program. So my students are not all local. In fact, very few of them are local. They are from all over the United States and sometimes outside of the United States. So generally, I'm having these conversations in our discussion forums. Like, for example, right now, one of the classes I'm teaching this semester is Introduction to Lifestyle Medicine. And one of the modules was looking at the environment and how that environment impacts someone's health or the choices that they make. And so looking at socioeconomic levels, looking at social determinants of health, the built environment, and having them look around them in their communities and also share experiences on what they have noticed, observed, or experienced themselves. So generally in my DNP classes, it's more conversation-based when they get to their DNP projects, if there's a lifestyle focus. So sometimes they will have a population that is a more vulnerable population, but most of the time it's addressed more in conversations in the discussion forums.
Okay, yeah. Deborah, do you want to say anything more? I know I kind of threw the future of nursing in there as a side note, but is there anything additional that you would like to bring to the conversation about that?
That's wonderful that you did that, Susie, and thank you. I think to just follow up on the great conversation happening around the future of nursing, that I think what I'd love to know is, when we look at nursing and these calls to action, we had the Future of Nursing 2010, and that was due to the nursing crisis. And now we have 2020, 2030, and we're making progress. I'd love to ask you if you could share with us what you think we need to be doing and where, and including other stakeholders, nursing supporters, government, policy, our physician colleagues, where you think some of the low-hanging fruit is for really moving this forward. Sometimes one area can move forward much more rapidly than another, and then it can pull things along. It can be shining a light. I think as nurses, we're being called out by the committee as being uniquely positioned to help lead because of the trust, 20 years in the polls, the numbers, 4 million, time at the bedside, touch points, all of that, and the paradigm, the whole person paradigm. And yet we're here and wondering, when will we be able to look and go, wow. So where are those real opportunities, the ones that we can move more quickly on, and who needs to be involved? And the other is, what gets you really excited about what you see changing now, or you just go, I can't believe we're here already. I can't believe I see this happening.
Good questions. As far as the future of nursing, just like I really encourage my students to be applying the principles of lifestyle medicine to their own lives first, I think that we as a nursing discipline, a body of nurses, have got to really take care of ourselves. The self-care, nursing is a hard profession, particularly hospital nursing. There's still a lot of nursing shortages and just difficult work environments. And we can't promote health to our patients. We can't make a difference in our own profession if our own health is not taken care of. I really like Healthy Nurse, Healthy Nation. The difference we make will be limited by the difference that we first can make in our own selves. So when I look at the future of nursing, I would hope to see nurses that are embodying these concepts of health themselves. And then it's just a natural outpouring of who we are, that it permeates how we practice and the decisions that are made in larger organizations. It would just trickle down or trickle up, whatever way. But I think it has to start with our own individual practices of self-care and making sure that we are embodying those principles ourselves first.
Thank you so much for that. I think then a follow-up to that would be, do we need to have louder voices? What do we need to do when, say, mentioning the acute care setting, when, okay, well, today you have 8 patients because we're short, or we need you to stay over for another shift, or all of these scenarios that nurses are facing. I'll never forget when I saw my first nurse on the big 6 West ortho neuro unit, and she was literally running, holding her bladder. She didn't have time yet. Or the nurse grabbing the donut off of the table. What do you think we as nurses need to do to embody that more? But that's a really powerful point, is our own health and how we are in the world.
You know, I've been out of acute care for a long time, and this is one reason why I left acute care. And I moved into long-term care, and that was worse. So both of those settings just chew up nurses. And what worked for me was to draw a line that this is not going to work for me, and protect my own health, mentally, emotionally, physically. I don't know what would happen if we all did that. I've never been one that has really, and maybe that this is not a good thing to admit, but I've never really been one that has been highly involved in politics, policy making. I remember working in an environment where nurses were on strike, and I came in working as a part of an agency and having to cross the lines. And it was a very negatively emotional experience for me. And so I've kind of drawn back from those approaches. But I do think that we have to respect ourselves. Maybe when you say our voices need to get louder, maybe it is the time to do that. If we can do it in a way that honors the profession, that does not put patient care at risk, those are really hard questions to answer. I just have seen the negative side of that, but I'm also appreciative of things that the ANA and other organizations like that are able to achieve for us. So, you know, there certainly is a place for policy at that level. For the average individual nurse, I think we probably need to be more aware of the situation in our environment, in our current work environment, but also the bigger picture. Because like for me, I don't have any of those work challenges right now, or environmental challenges. So it's easy for me to kind of have my head in the sand that it doesn't really impact me, and I don't think about it as much. But that doesn't mean I can't be part of the solution. And so I think really a thoughtful question that we all need to ask is, first of all, what can I do for my own health? And then how can I speak a little louder? Who can I influence? We are all called to be policy makers, but we all have a circle of influence. And so maybe it just needs to start right where we are with our own health, and then who can we influence to bring that message out a little bit longer.
Thank you so much for that. That's really important, because we are all called in different directions. We all have different skills. We have different talents and inclinations, and we're in different spaces. But first, it's really beautiful how you put it. It's first about the self. As Susie often reminds me, think of the airline, put your own oxygen mask on first, and then what else might I do? And then we can each look around and say, oh, maybe my local representative is in town, and I can just say, can I tell you a little bit about nurses? And just that exposure that nurses are so much more than what someone might imagine, or here's some statistics, may I leave these with you, or here's some of the issues, and we can pull them out of any of the journals about what we're working toward. And then, as you say, the Healthy Nurse, Healthy Nation. Here are nurses that are taking better care of themselves, that are role models for everyone else, and building that big tent of the Healthy Nurse, Healthy Nation and inspiring other nurses. That's one place where we can influence, is right there.
I like the word you used, role model, because yes, it's about self-care so that we can be the best nurses that we can be. But being a role model will influence our patients and make our conversations with them have more validity. And being a role model to the rest of nursing and outside of nursing, the difference that we can make. My students and I were having a conversation about night shift and how sleep deprivation impacts us as nurses. So I think bringing in some of the data and some of the health related issues to conversations that we may be exposed to, I think is an initial good way of starting, is just to be more aware of and initiate these conversations, even if it's not in a huge way, like, on Capitol Hill, but around us.
That's beautiful, just around us, wherever that may take us. And then may I just ask one other follow-up question to that, was the other half, which is, what really gives you a lot of hope? What's the good news? What's exciting that you see out there on the horizon from your vantage point?
The growth of American College of Lifestyle Medicine, that's exciting. The growth of the RN APRN member interest group, the interest here on my campus, both in the graduate level and the undergraduate. And now we have a lifestyle medicine interest group on campus, so it's trickling to other disciplines on campus. I think that's exciting. You just start to feel a little bit of momentum. You're not just pushing, but you're actually starting to see a swell.
Thank you so, so much.
Thank you so much, Dr. Tryon, for all of this information and for your time. The only thing that I would ask in addition would be, do you have advice for people that want to do this same kind of thing that you're doing in the nursing school, or anything else we didn't ask you that you think is important that someone just listening to this would need to know?
I would say follow your heart. If you feel called to bring lifestyle medicine into a course, or to develop a lifestyle medicine course, or a culinary medicine lab, or a lifestyle medicine interest group, or whatever you feel, begin looking, because my guess is you're not alone, and you'll find like-minded people. And eventually, as you start talking, things will develop as way bigger than you even imagined. Just seeing what's happened on our campus through conversations, the lifestyle medicine interest group, a plant-based eatery on campus, the culinary medicine lab, those were not on my horizon, but they all initially started just by having conversations with my colleagues on what our dreams were. And then we started having conversations with others, expanding that circle. And then eventually it moved faster, brought more people on than we thought would happen. So I think start with where your passionate is and find some like-minded people who share that passion, and just start meeting and talking and sharing ideas together. Bring other people on board as well.
Yes, I love that. We've heard that too in other places when people have just started a lifestyle medicine student interest group. It was 5 people and it grew very quickly to 80, So exactly, just start where you are. That's perfect. Well, thank you so much for your time. We so appreciate it. We know that you have so many years of experience, and a lot of other people can learn from you for sure. So thank you so much.
Well, it was my privilege. Thank you.
Thank you.